tension strengthens the tendon, not rest, not ice, not stretching. Hi everyone, my name is Dr. Amanda Zariello from Restore Physical Therapy in Cranston, and today we are talking about tendon pain. Oftentimes people will complain of tendonitis or tendinosis, and we can get tendon pain anywhere in our body. We have tendons in our shoulder, our knee, elbow. The most common areas that we treat are elbow tendonitis and shoulder tendonitis. So today I'm going to talk to you about what is a tendon, what's its function in the body, and how do we help it heal when we are dealing with an injury there. So first, let me tell you and show you what a tendon is. So here's my little knee joint, and you see we have our quad muscle, and then this white piece attaches to the patella is the tendon. And the biggest thing I want to point out with the tendon is that it's white. And the reason why it's white is because it's a type of connective tissue that is made up of collagen, which doesn't have a lot of blood flow. It doesn't have the same amount of blood flow as a muscle, which is why it typically takes longer to heal. The function of the tendon is to help absorb force, okay? So our muscle attaches to the tendon, which attaches to the bone, and it allows our joints to move. And when we do certain activities, walking, running, jumping, throwing a ball, if our muscles aren't able to sustain the force or create power in those movements, the tendon is going to take more stress, which can lead to inflammation and breakdown of the tendon. So the two different types of injuries that we see at the tendon are tendonitis. So itis is inflammation of the tendon. So oftentimes the tendon will be maybe swollen, red, you'll have more sharp pain. And this usually happens in an acute injury. So like right away, say you go for a 5-mile run and you haven't really been training to run 5 miles, your knee might be like screaming at you the next day. And that's that acute inflammation. Your muscle just simply wasn't ready to sustain that load of 5 miles. Or it could have been a new workout that you just ramped up a little too quickly, and the muscles weren't able to really help you throughout that entire workout, and the tendons are aching and sore. Then you have tendinosis. So tendinosis is what we don't want the tendon to get to. This is more chronic, and I like to explain it as if it's a rope that's fraying. So the inflammation is actually not really there anymore, but the tendon has been constantly overworked, that rope is fraying, and the tendon is like the scaffolding of a building. It should be wired together nice and strongly. The tendon is fraying. We want to think about how can we rebuild and regenerate and realign those tendons to build up strength. So a lot of people think, let me rest it, let me ice it, let me stretch it. That actually can make it worse because tendons heal through tension. So how do we load or create tension in the tendon? It's by activating the muscle that attaches to that tendon. So for example, if someone has elbow tendonitis, so the tendon inserts right into here, the elbow, we want to load and create tension to that. So there's multiple ways of doing that. When you're really in acute pain, you can do something simple as just holding this weight just like this without going through any ranges of motion. This is called isometric strength training. So the muscle is tightening, it's activating, and it's supporting the joint, but it's not going through a range of motion. This is the best way to start when you are in acute pain. The other ways to load the tendon is to help to control lengthening. So if I were to do a bicep curl and then slowly focus on lengthening that muscle, that is a type of contraction that helps to control the joint in a more slowing down response, which is very important in stabilizing the joint. And then the third type of contraction is concentric. So if I'm focusing at my elbow, doing like a bicep curl, that's gonna strengthen it concentrically. So I'm activating the muscle and I'm shortening it. Similar to the wrists and the elbow is I'm just going up and down, and this is strengthening the wrist extensors concentrically. Okay, so The real idea is, one, to progressively load the tendon over time. So that's where physical therapists come in play. We're gonna teach you how to advance your strength program to the tendon and that muscle. So when you go back into running or throwing or playing pickleball, all these areas that can stress the tendon, you have enough muscle strength, enough power, enough force, so your body can effectively and just efficiently be used in those activities. So the biggest message here when it comes to tendon pain, tendonitis or tendinosis, is tension strengthens the tendon, not rest, not ice, not stretching, although that can be helpful. Long term, we want to build strength around it. That is all I have today on tendonitis and tendinosis. If you have any other questions regarding any pain that you have, you can reach out to us at Restore Physical Therapy.